Hello, everybody. Dr. Unati here, aka Dr. M Health Corner. This is my first live, guys. I'm excited I could do it. Happy Christmas, Merry Christmas, Happy Holidays. How is everybody doing? You know what? I thought today, before we close this year, I should do this live. Actually, I'm so sorry. We were supposed to go live. I presumed it was going to be live, an interview I was going to do with a lovely lady in Nigeria, but it was Twitter and she's struggling with connection. That is the biggest problem we have in Africa. But you know what? I thought because I posted something on my page about men, as you know, I'm passionate about men's mental health. I'm passionate about depression, teaching people about depression, about boy children, how to take care of them, because I just feel globally we're taking care of girls, boys, but what's happening with boys and men? We're not looking after them. So I just felt this is a population that I feel we complain about, but what are we doing as a society to help them? So today I want us to talk about something very close to my heart: depression in men, and also how we could help men and boys to seek help, and also seek help actually instantly when they're feeling these symptoms. First of all, I want you to know that globally the stats shows that there is 264 million people living with depression. This is basically globally includes men, women, kids, like all races, all cultures, all sexes are on the stats. So we have to 64 million. And sadly, 800,000 people commit suicide every year. And the sad part is, do you know what's the age range? It's 15 to 29. Very sad, right? So I thought in that percentage, as you all know, it's mostly male people. So how do we help them? So I want men here who are here on this live or who will actually watch this again. I want you to know this. You are also human. You also have the same emotions women have or girls have. Please, if you have any of these symptoms I'm going to mention, please seek help. See your doctor, see your counselor, see whoever you trust. Go seek help, because it's important that you need to understand that depression could hit anytime. Right now, we're struggling with COVID-19. COVID-19 has caused so much pain. People have lost jobs, relationships, marriages, broken families. There's also domestic violence. And I also want you to realize this. Men tend to be violent sometimes when they are depressed. A lot of times people don't know that. Depressed men could be violent sometimes when they are depressed. And if you are not careful, if you are a doctor or you are a nurse or a psychologist, whoever deals with you might miss your symptoms. Men sometimes they present with overworking, and sometimes their spouses will be excited thinking that my hubby is working so much, he's gonna make that money, we're gonna go on holidays, and your man could be depressed. Right? So I would like people to pay attention to that. Men who are depressed sometimes work a lot or even work out a lot. All right? They work out a lot, they go to the gym because they don't want to deal with their emotions. And sometimes, of course, we're going to talk about the main symptoms people have: being depressed mood, and no interest on stuff you used to enjoy. And of course, poor appetite. Your sleep is also interrupted. Your weight, you could gain weight or you could lose weight, and unfortunately you might have suicidal thoughts, and some people even commit suicide. These symptoms could be ongoing for a period of 2 weeks. Go see your doctor. Please go see your doctor. And we know this, a lot of times men tend to see us almost a year after they've been experiencing these symptoms. Please, guys, go and see your doctor. I know that there's been this for the whole time. Men and boys were always taught to be strong, to show up as these strong beings, and we all know that it's mostly them that go to the wars, them that always are homeless. A lot of times they are them that occupy the prisons. It's men who are who commit suicides and also are involved in homicides. A lot of them, it's men on that stats. So how do we help men? I would like to actually hear from you guys. How do we help men? And women who are watching me here, thank you for watching. Kindly be compassionate. Be compassionate, be kind towards your boy children and also your hubby, your brothers. Let them feel their emotions. Let them show their vulnerability. Let them show their vulnerability. And of course, like I said, there's many causes. I always look at them as biological, psychosocial, social. Like I said, there's loss. People lost jobs right now, relationships that could actually lead to depression. And of course, COVID-19, there's so much happening. People died from this. Bereavement, you could fall into depression because you've lost your spouse, your mother, your parent, your father, your uncle, your friend. This could lead to depression. All right, so these are the things that a lot of times men downplay, not realizing that they could actually eventually have depression. So please seek help. And of course, medical conditions. People, when you are diagnosed with cancer or sometimes heart disease, we also have HIV, cancer, so many chronic illnesses or diseases. These could lead to depression. So we always advise people to watch how they live or lead their lives so that you can live a healthy lifestyle. It's very important. All right. And of course, other illnesses like thyroid disease, if it's underactive, it could lead to depression. Heart diseases, there's so many chronic diseases, lupus, all these autoimmune diseases could lead to depression. Okay, and of course, I mentioned psychosocial bereavement. We talked about that, and also family history of depression, guys. We do see depression in families, and if you know of your uncle, your aunt, your parent who had depression, you have a risk of developing depression. So take that family history and bring it forth to your doctor so that you can get the help you need. So how do we manage depression? Obviously, there is medication. Not everyone goes for medication. Some people do well with just psychotherapy. You go for counseling. And also, we have a specific therapy we call cognitive behavioral therapy. It's so direct. It takes 3 months, intense 12 weeks of doing these sessions with your psychotherapist. They usually help our patients with these symptoms. And of course, some people, they need to be on medication, which could minimum, we treat depression for 6 months or longer. So I would like people here watching me to remove the stigma around depression, because depression could hit anyone, any socio-economic status, any race, any culture. I would like to start seeing people talking about depression on their tables, in their dinner times with their friends, families, that, you know what, I struggle with depression, like we do with colds, with high blood pressure, with diabetes, right? So I would like us to start talking about this. And we thank God for, honestly, for COVID that happened to all of us, affected us. We are all vulnerable. People are starting to talk about depression and anxiety because it has brought so much emotional turmoil, right? So in closure, I'm gonna again come back here with my the lady I was supposed to come back with on her live, and we're gonna talk more about how do we help boy children and of course men to curb the symptoms of depression. Thank you so much for watching. Merry Christmas. God bless. Be safe on the roads, and let's keep social distance. And of course, the vaccine is out now. People who are interested in the vaccine, I would encourage them to go. It has studies. It is proven to be safe. All the best. And of course, God bless. See you in the new year. Thank you.